So thank you. Now, our first speaker is Paris, and Paris is a stoma therapist, our nurse educator, and all sorts of things rolled in one. I rang him on Monday. I couldn't get through. He rang me back. Welcome, Bob. And he rang me back and he said, "Oh, sorry, I didn't get a very good reception because I'm in India." So he travels doing his work to Southeast Asia, China, New Zealand, Pacific Islands, Australia, and so he represents a company called Liberty, which is a parent company. And I'm not doing plugs, but I need to now, which is Hollister and Dansack. But they've funded for Paris to come up, and accommodation and airfares and all that stuff. So we need to thank them for doing that too. And that's not to take away from the trade and the other things that the trade people do for us. So Paris, I don't think I need to tell any more stories about you because you can do it yourself. Thank you.
You're telling stories out of school. Right, yeah. Let's do it again. Alright, everyone can see that? This is a bit of a basics, back to basics session. It's really trying to get a level understanding about what's important, particularly when you're first going home. But even once you've gone home, things change dramatically and things can change over time. So today I'm going to cover a few things. We're going to look at some ostomy basics and skin barriers. So that the skin barriers are the adhesives that stick to your skin. We'll look at what healthy peristomal skin is, and we really want to talk about skin a lot because we really should be putting skin first. If you don't have healthy skin around your stoma, we have an issue. So we really need to focus on skin because that's really important. I'm going to show some different peristomal skin conditions on one slide. So I've got a big warning on that one. There'll be a warning on that slide as well. If you don't want to look at that, just close your eyes like a horror movie. If you feel like it's going to be too confronting for you, by all means, please do so. And then we'll look at what we're calling fit and formulation. And then also, lastly, we'll look at when to seek advice, when you should probably go see your stomach care nurse. So as we go through, feel free to ask some questions. I'm sure a lot of this will be familiar to you, but some of it might be new as well. So when we look at ostomy basics, we have our three main stoma types, and so this is your colostomy type surgery. Sometimes you will have an end stoma, sometimes it's temporary, sometimes it's not. And that's where you've got the large intestine connected to the skin. So sometimes the output is either liquid or it's a formed stool because it's further down the intestinal tract, but that can change. So if people, for instance, pick up a bug like gastro, or they start chemotherapy or radiation, that can cause the output to change. And that might mean that the pouching system that you started with may no longer be suitable. So that might be time to actually reassess. Because if the output's really liquid, you might need something else to make sure you don't get any of that content onto your skin. And of course you have gas and odour, which is why you'll find all products now have filters these days. Ileostomy, you'll see that it's a small intestine, so this is a nice, neat, buttered. She thought it looked like a rose, so she got a tattoo next to it of a rose. By all means, you don't have to go and get a tattoo around your stoma, but that made her feel comfortable and call her stoma Rose itself. So this is a really good stoma. We would love, from a nursing perspective, if every single patient looked like that. This is just fantastic. But unfortunately, for lots of reasons, we don't get great stoma construction. So this is where you've got that small intestine attached to the skin. The output is always pretty liquid. Sometimes it'll get to toothpaste consistency, but it contains a lot of enzymes. And these digestive enzymes are designed to break down proteins and fats as their food. Well, skin is made up of protein and fats, so it doesn't discriminate. So the enzymes come out and they just think they're still having lunch, so they'll start eating up on your skin. So ileostomies are very, very prone to more periostomal skin complications than any other stoma type. So if you have an ileostomy, it's probably worth really checking that you've got a good, secure skin seal. Gas may or may not be an issue. Sometimes, people swallow a lot of gas, they can make gas, or sometimes there's what they talk about being pouch fermentation. So sometimes it's like a little brewery. You get a bit of beer happening in the bag, and because the bacteria in the bag itself are making all the gas. Usually there's not a lot of odour. So usually they can often smell relatively sweet. There's not a lot of odour with them because there's not very many bacteria. Your urostomies, most of the common types are your ileal conduit. There's lots of different types of urostomy, but the main one is what we call an ileal conduit. So this is where they take a piece of small valve and they bring it out to the front, and they put the ureters from the kidneys into that little piece of valve, and then they bring it out to the surface. And these are stents. They're only temporary, so they only stay in for a period of time for most patients, and before they're removed, and then the stoma just will look like a regular stoma, and then urine comes out. The difference with the output from, unlike normal urine from a bladder, there'll be a lot of mucus, because the intestine that is used secretes mucus all the time. So that's what happens with urine from an ileal conduit, because it's going to have the mucus in there, it's naturally present. So some people sometimes think that that's infection. So you need to have an understanding that that little bit of mucus in the bag, or the strands of clear white mucus, don't represent necessarily an infection. You'll normally get, pain in the kidney or the back area. You might get smelly urine, things like that, which might indicate more that you've got an infection of some description. So stoma construction is also different. We have what we call an end, which is sort of like one end only. We have a loop where you've got them side by side, so you have one coming from the mouth and one going to the other end of the bowel, so that's a loop stoma. These are generally temporary. They're easy to close, pull them up and join them back together. Sometimes you'll have double barrel, where they're actually not connected, you've just got two stomas side by side. Sometimes a double barrel is one stoma here and one stoma over here. It's not necessarily right next to each other, so they do have variations. And the continent stomas I'm not going to talk about. These are other stomas where they have a little valve and people have to catheterise those. So this is what we would call in the textbook our perfect stoma. So you saw the one with the rose earlier, this is the same sort of thing. This is really what we want here, to have that healthy periostomal skin. So in your mind, when you're looking at your stoma, skin around your immediate stoma should look like skin on the other side of your abdomen. Is really the golden rule. We want you to understand that. The problems that impact healthy periostomal skin are things like occlusion, because you've got something sticking to it that's just covering the skin, and that's not natural. We don't walk around with something on our skin all the time. Changes in pH because of the output. Maceration because it's sweating, it's collecting fluid underneath, so maceration is a really important issue. Irritation can come from the output again, so that chemical irritation can really cause some skin issues. And shearing forces are often from the adhesive itself. If the adhesive is too aggressive on the skin, or if taking it off is incorrect, there are techniques to make sure that you get your stoma pouching system off really easily. So things like making sure you press the skin away from the barrier, using an adhesive remover spray or something like that can help make sure that removal is much better. So we say this is perfect because you've got everything here is smooth, absolutely smooth. We've got a good height on the stoma. The opening, importantly, is in the middle. So sometimes it can look like this and the opening is here or down here, which means it's going to fire in the wrong direction, which means you get leakage. So we've got to make sure that we have a product on that's going to correct that. So there's lots of different products that can modify your pouching system just to make sure you don't get the leakage. So always remember, if you get leakage, don't try to patch it up. I know there's products called barrier extenders, these adhesive or elastic tapes that stick around the borders for that security feeling. The challenge is sometimes people get leakage on the side and they think, okay, I'll just put a piece of adhesive tape down the side and stop the leakage. But what you're doing is actually trapping that leakage under the barrier, and that can lead to a skin problem. So if you're leaking, product must come off, because obviously there's something that needs fixing. We often get asked, how long does your product last? Or how long can I wear this product for? And the only real answer around normal wear time is really what your expectations are, what you can get used to in terms of your output, because it always depends. It can be a choice, you might want to leave it on longer or shorter, what your needs are and your expectations. But if you have a stoma that's got a really high moisture content, lots of watery output, it probably will eat through the hydrocolloid barrier on your skin much, much faster. So that means you probably have to change it more frequently. So understanding how your body reacts with these adhesives is really important. If you've got something that is designed to stick to your skin very, very well, and you change it frequently, you're at risk of skin damage from taking off those top layers of skin. So it's really important that you understand what's the best wear time. So when you're talking to any of the manufacturers, you can ask them, you know, what's the wear time for this or what's the wear time for this. Really it's about it depends still, but you'll find that there's different recipes per manufacturer, and some will last longer and some will last shorter. So it really does depend on what that formulation is into the barrier. So these are the things that really will impact wear time. So the stoma and output. So it doesn't mean that every colostomy has this or every ileostomy has this. Really it's the output. It's what's coming out that's going to be the factor that will decide that. What's happening with their skin? Do they have anyone have a pre-existing skin condition like eczema or etc. on the abdomen? And the landscape, when I'm talking about the landscape, is are there any creases? Are there any folds? Do these appear when you're sitting or bending, etc.? So that's another trick as well. When you are getting looking for your problems, always look at yourself maybe in the mirror in the sitting position. Because that's what our nurses should be doing as well, is to assess if there's any problems. We call that pouching for the worst case scenario. You'll actually see skin folds appear in the sitting position. If you're lying down flat, everything tends to smooth out and then you can't really see what's going on. So always have a look in the sitting position to make sure that you can see any skin creases that might need something on to fix them or push them out of the way. Other complications which can include things like a peristomal wound, and other medications that might impact that as well. Humidity is another big one as well. And I know sometimes in the summer months up here, we particularly get very, very humid. You get a lot of sweating, and that will obviously lead to a lot of other things, like sometimes your wear time will go down. This is where we find, this is the time of year in summer is when most people report itching because their skin is sweating and they've got the moisture trapped against the skin. And then how often you empty, so that's a big factor as well. Sometimes we have people who will they'll empty their bag when it's ballooned completely full, right? And that creates a strain on the adhesive. It's really that 1/3 to 2/3 full, no more. Even a half, is probably 2/3 is probably going a bit far because that can create strain on the adhesive. So always make sure you've got regular emptying that's going to facilitate that. And then also, this is just sort of like right size, right product. Size is really important. You would have been taught in hospital, you know, measure your stoma in the first 6 to 8 weeks, because that's when you'll have changes, and that's true, you have very, very dramatic changes, but there's been a study recently that shows that even after 2 years, your stoma can continue to change shape and size. So every now and then, recommendation, get a stoma sizing guide from any of the manufacturers and just re-measure your stoma to make sure it is actually the same size. Because you get lots of problems if you're cutting the barrier out that little bit too big. So make sure that your stoma is actually the right size. So always re-measure your stoma at least once a year. Even if you've had your stoma for 20 years, it's still probably a good idea. Because some people put on weight, some people gain weight, some people develop a hernia, so that will change the dimensions of the stoma. So really worth just double checking on that. And which accessories are you going to use? And I'll talk a little bit about some of the accessories in a moment, but I don't want to belabor the point. They're really good in some instances for customising your pouching system, but I think there is an overuse of accessories as well. Less is more. If that's one message I could leave with you, less is more when you're coming to your accessories. So here's this example of why I talk about maybe removing one accessory altogether. When you put a skin barrier or the adhesive on your skin, you take the barrier backing off, so you're peeling the product part off, and then you've got the release paper or film in between. That will go to the skin surface. So you want your skin barrier to stick directly to the skin. You see that there's nothing in between. Okay, we don't want to be putting any lotions, and this is where I do the barrier films. No, if you've got barrier films and you're routinely using them, contrary to a lot of misinformation, they don't increase the adhesive of the product. They are a chemical. The material and the adhesives are designed to stick to your skin. If you put a chemical in between, you can set up a reaction and then they blame the product, not the actual wipe itself. Because people think the wipe is clear, it's okay, because it must be this. Well, it's usually those skin protective wipes. So any of those skin protective wipes, barrier wipes, they have a place for sure, but they're not to be used for everybody. So that's probably the most overused accessory that there is. If you're on them and you're finding you're having issues with itching, reaction, your skin looks a bit funny, and it looks like type of the shape of the barrier, if you're using a wipe, I would recommend you discontinue the wipe and just use water. So that's back to that keep it simple scenario. Clean with water, nice and dry, pop your product on. So just some ideas around peristernal skin complications, or what we call PSCs. I'm not going to go through all of this. This is a lot of data, but there's a lot of information that shows that, you know, in other studies as well, that, you know, this is high. 3/4 of anybody with a stoma at some point in their lifetime will have a skin condition. Now that's not good. We've got to change that, and I think that helps with a bit of awareness. So for you guys, just understanding what you should be looking for in terms of managing your skin, because it really has a significant impact. Particularly on some people, you may not notice, but other people really do have significant quality of life impacts with this. They do cost because you've got to manage them, so it might be a nurse visit, it might be extra products, and it can be extra time, because then you've got to add all these extra steps to try to fix this. So it does cost this way, but it really costs emotionally as well. For you, it would be like, you know, I've got a really bad skin problem, it burns, it's uncomfortable, I can see it, it's visual, it's not a good thing. So that's not a great mindset to be in. So we've got to make sure that your skin always comes first. So always make sure your skin is good, and then you'll be really good for the rest of the time, really. So skin is the first thing to think of. And then of course it's draining on the nurse as well, because this takes up their time. You've got to come back in, you've got to review, etc., etc. So, and nurses, you know, we love doing this, but it really shouldn't get to that point in the first place. So let's think about prevention for that with your skincare. So this is just some evidence that really talks to how peristernal skin complications can impact. This is called the health utility, and really it's a ranking of how you feel about yourself in terms of health. 0 is death, right? So that's pretty poor. 1 is your superhero, best attainable health that there is possible. They've been able to, you know, put through surveys all of the different types of conditions. And only recently we've been able to do that with stoma care. We've often talked about quality of life being an impact for people who have a stoma in terms of this, but we've never been able to measure this. So this is actually a measurement that we have now. So doing this will still the best attainable health. The average person on the street, so surveys are on the average person on the street, we've got the best health outcome is 1, and the lowest is death. The average person is a 0.74, which seems low, but actually some people have back pain when they're being interviewed. Some people will have the flu. Some people might have a COVID cough or whatever have you, and they're not feeling great that day. So it's really a snapshot in time, but it's done over an extended period. So the average person rates themselves on 0.74. So if you have a stoma, how would you generally rate? What would you think might be the rating for most people who have a stoma compared with the average person? Any guesses? 0.5? That's same. Love you. Yeah, it's about the same. Now this is very variable, because we know some people, you know, if you've got something like ulcerative colitis, for instance, and you've had it for 15, 20 years and you're sick, and you're trying to get to the toilet every 5 minutes, or Crohn's disease and something like that. And then you put up having a stone, and then you get a stone, and it's like, oh my God, it's changed my life. I should have done this years ago. So they're like a 1. So, but on average, it will depend. And also, people with cancer, it can be a sign that it's a negative, but it's also a real positive. This saved my life. So they're actually not too bad. But the caveat with that is if there's no periostomal skin complications. If you get a mild, moderate, or severe, it starts to really drop. So this is why skin health and skin care is really important for you. You've got to make sure that everybody has healthy periostomal skin. So if you even look at mild or moderate, that goes back to this area here, severe heart failure. So some people who've got really severe periostomal skin complications, they have a big impact on their lives. So we want to make sure people don't get to that. So that's an important thing to consider when you're looking at your skin health. Don't ever underestimate the value of your healthy periostomal skin. So, where's the warning? Sorry. So there's my warning. If you don't want to look at some gory pictures, I've got a whole slide full of gory pictures, and I just popped up. Sorry about that. I'm only going to talk briefly to some of these here. So here we've got something like mucocutaneous separation. It's usually in the earlier post-op period. This is probably the one that is the most common. This is what we call irritant contact dermatitis. This is from leakage. So you can see here, you've got damaged skin, you've got a lot of moisture, you've got a lot of erosion, so that's probably the most common. That's just leakage. Leakage gets onto the skin. I mentioned those enzymes, yummy, we'll just eat and keep eating at that skin. Here we've got a reaction and sensitization to the materials within the hydrocolloid. Same with this one as well. You can sort of see that the patch is dead. It's always worth asking, is it really this? Or is there a barrier film being used? Because the data has shown that only 1% is true allergy when you're using an ostomy product. It's usually something else that's causing the issue. So it's always worth checking what you're doing. Some people put Dettol on their skin, some people put Metho on their skin, lots of different things, or they scrub their skin excessively. So it's really gentle skin care. Again, this is like this one, it's irritant contact dermatitis. Here you can see we've got allergy to this particular product, but this is a hydrocolloid seal, a different material on this one. So you can see the skin's nice and healthy here, not so healthy here. So whatever this is good, whatever this is bad. So maybe we need to change the pouching system. So that's a really clear one. This is what we call folliculitis. So any of the gentlemen have hairy abdomens. Make sure you clip, not shave, when you're managing your skin. Because if you shave, you get too close to the skin, you take off that and you create a stubble, and then your hair gets trapped. You get bacteria, and then you can cause some issues with that. So you really want to make sure you use a clipping motion and keep a little bit of stubble, so you're not allowing bacteria to enter the skin. So this is pretty severe. You can see here there's a bit of paste just left over from the barrier, but this is really bad leakage. So this is a severe periostomal skin complication. That can take time to heal. You can imagine the pain and the discomfort. None of you should ever get there. Okay, so we really want to make sure fit is really important, but it's not the only thing. And then this one looks fantastic. We'll be looking at that, but this patient is actually really suffering from something called itch, which I'll talk a little bit about. So this is, sometimes it's itch and you have no idea why someone's itching. So if you're sitting at the dinner table and your partner or spouse is sitting across from you and doing that all the time, maybe they've got that little bit of itch. I had a friend who's got an ostomy and he was doing that, and I was like, what's going on? No, nothing, it's just normal. No, that's not normal. Let's talk about how we can fix that. Oh, but I take it off and my skin looks fine. It's just what I put up with. You shouldn't put up with that. Itch is a problem. So itch, the real name, the full name is pruritus, and it's that wanting that desire to scratch all the time. So you get this itch scratch cycle. I don't know if anyone's ever had an allergy on their skin, and sometimes you scratch and it just gets more and more itchy, and you keep scratching and scratching like a mosquito bite. You're sort of getting some histamines in there and things like that. So when it's short term, like a mosquito bite, etc. It's pretty not lasting very long, but it may be difficult to treat and it can create a significant impact if you're constantly scratching, like trying to get in there. Sometimes the itch will drive people nuts. So if you have itching, a lot of people with stomas will actually talk about this. They say that it's really significant, and a lot of clinicians don't ask, or the patients will recommend. It's kind of like, well, this is something that happens. This is just something that actually happens. This particular lady nearly quit her job because the itch was driving her nuts. I mean, you look at that and you go, I don't know what she's going on about. It looks fantastic, but the itch was so severe. They put her on lots and lots of corticosteroids, some steroid cream to try to calm that down. And that can calm it down for a while, but it's not a long-term solution. And long-term steroid use on your skin is not good because it changes the function of the skin. So if any of you are using long-term steroid, probably worth checking out if you need a review, maybe look at something else. So the skin can itch even if it looks completely healthy. So 87% of people have reported they do have itching. And it appears to be healthy, and 71% of nurses surveyed recall that patients actually say, oh, you've been itching, but they've got healthy periostomal skin that looks okay. So there is a lot of data that shows that this is a real condition now that we need to look at. So this is what sometimes people do to make, that makes it better or worse. Being in a drier environment sometimes helps, so they're not that high humidity. Sometimes they'll use an antifungal powder, but heat makes it worse. You find that, like I said, in the hot weather, you find that pretty bad. Humidity makes it worse. And then this is removing and replacing the pouching system just to get relief. That means they're changing things more frequently. Now that actually is a problem because you're creating more and more skin damage by all that frequent removal, so it's not a good thing to do. Pressing on the pouching system, so sometimes that can just get relief by just pressing through there. It's kind of like if anyone's ever had a broken leg, you have a cast on and people shove knitting needles down there and rulers to try to get that scratch. It's exactly that kind of scenario. And so you're doing all that scratching, you're trying to rub that area to just get some relief. So it can be a real challenge. So I want to talk a little bit about ceramides, which is what you've got in your skin. So everybody has ceramides within their skin, and it's in the outermost layers or the top surface of our skin. And they help give that waterproof barrier and they keep the skin moisturised. They're a natural lipid that is within your skin. And they've been shown to reduce that water loss. And water loss, actually from the skin, promotes itching. So you've got the removal of ceramide. If it's in the top layer of your skin, every time you take a pouching system off, you are removing ceramide from the skin. Now, if ceramide is keeping your skin moist and happy and healthy, you're going to have less there, which means you're going to get more itch. So there is an issue with that. Lots of products these days, it's kind of like the new thing, ceramides, if anyone's in the beauty industry or something like that, or even the hair industry as well, everyone's kind of whacking it with ceramide into everything that they have. And then there's products that actually do have ceramide as well put into that because it's become an awareness that ceramide's being removed every time you change a product. pH is another important point. I've talked about the enzymes that we have that come out and eat your skin. There's a pH scale, I'm sure most of you are familiar with this. Water is pretty neutral. Interestingly though, skin is here. Skin is around black coffee. Okay? It's actually a little bit on the acid side. So your natural skin surface should be acidic. The enzymes that come out of your stoma with an ileostomy are up here, between 7 and 9. Way away from your healthy skin. So pH has a big impact on your skin. So looking through the body here, I mentioned this is your ileostomies, and even your stoma output from your colostomies can actually have quite an alkaline pH, which is miles away from what your healthy skin should be, which is that 4 to 6 point. So slightly acidic, that's why you would have heard, I think, the acid mantle. It's really important to maintain your skin very healthy in that way. So intestinal and urostomy fluid is pretty near neutral pH. And so this is where your enzymes are active. Inside the gut, That's where they're the most active because that's where the pH environment works for them. However, if we can change the pH that's out here, just ever so slightly, so this is output coming out, 7.8, skin is here. If you can change where the enzymes are happy, they'll stop working. It's just basic principle, it's just straightforward. If you can just change that, they'll stop working. So that's called buffering. So here's where we've got a product here, where there's no product, the enzymes just keep working and eating, whereas here, if you're using this product tray, it'll diminish the pH. It brings it right down to the level of the skin. So that's where we talk about fit and formulation. I mentioned that the fit is the really critical point. Make sure you measure. Make sure you've got the right fit and the right product. This fit will go, 95% of the way, but it's not just about fit. Sometimes you get the perfect fit, as we've seen in some of these patients, but they still get problems. So fit is not everything. Fit's a good part of it. So it's kind of like this analogy here, fit to formulations. My glasses will fit Graham's face, and his glasses will fit my face. But if we're using a different prescription, if he's like a 3 and I'm a 2, that's not going to work. So the formulation is really what makes that work. So they may fit well, the formulation's not quite right. So have a think about it like that. It's not just the fit, it's also the formulation that you should be looking at. So that's why all the hydrocolloid barriers that you see out there, they're all different. Every company has a different type. So it's always worth finding out what's in them and asking about them a little bit more. So when to seek advice from your nurse. I would suggest sooner than later if you have a problem. If you've got something minor, sometimes though the problem is some people think something is minor and then the nurse will look at it and go, oh my God, that's big, we really need to fix this. So if something doesn't look right, if it doesn't look like the skin on the rest of your abdomen and you can't manage it, go see the nurse. Or make an appointment to see a specialist who knows what they're talking about. There are ways to manage that yourself, absolutely. Don't go to home remedies, Dettol, scrubbing, antiseptics, creams, lotions, potions that are not designed to work near the stoma because you can cause some issues. Don't just think it's this because it looks like this. Skin conditions resemble a lot of different things. If you've got that unexplained itch, it just won't go away, your skin looks good and the itch is driving you nuts, probably worth going to see as well. Or if your spouse just comments to you, I see you scratching all the time, worth doing that. Leakage, of course. If you've got leakage and you can't fix it, and you're making sure that you're not stop-gapping it, just sealing it all against the skin. If you can't fix that leakage, it's important that you go get reviewed as quickly as possible because skin damage can happen within 24 hours and sometimes it can be pretty significant. So always see your nurse as quickly as possible. And if you're finding your wear time's changed, so if you're lasting 2 to 3 days and suddenly it's down to 1 day, maybe something else is going on. So it's worth finding out if your wear time is diminishing as well. Any changes in your skin. So if you see anything irregular in your skin that wasn't there before, that suddenly appeared, always worth asking somebody about it. Do I have any questions from anybody today? That was a short, sharp, fast one.
I used to get leakage because I've got a hernia and I was using a one-piece flat. I just happened to have a convex one at home, so I tried it, that fixed the problem. And I could wear mine anywhere from a week to 12 days.
Wow, that's good.
That's brilliant.
Yeah, and when you're getting onto your hernia management, convex can be a great solution. But sometimes you might need a softer convex. I don't know what kind of convex you're on. Just be careful. So it's worth checking your skin as well. Because your hernia is an outward bulge, and it's pressure. Convexity is an inward press, which is pressure. So you get pressure and pressure meeting together, and that can cause skin damage as well. So just keep an eye on your skin. If it's looking bruised or purple, it might be excessive. If it's not, you're happy.
That no leaks off your skin. I don't use adhesive remover or barrier wipes.
Fantastic.
I don't even use it. Or I just put the bag straight on without even the ring and it's perfect.
Right. Yeah, just continue to monitor that because if your hernia gets bigger, just keep checking your skin. If the skin looks really good, that's fantastic. his partner, is something you want to tell us?
He was taken out, and when he puts the seatbelt on, he seemed to have leakage. He said he's losing weight as well, but it just comes apart.
Well, so it might be for a time for a review. How long did he have it? Did you say it's new? So, a couple of things that I'm really an assessment. It could be a bunch of things. So, if he's in a flat product and he's lost weight or changed weight, he might need something like a convexity. Check that he's not using something that is reducing the adhesion like a wipe or a cream or something like that. So, if it's just clean water and putting the product on. And then if it's just literally the physical thing in the seatbelt itself, like if it doesn't happen at any other time, but it sounds like it might, because it just seems to be odd that a little bit of a rub will do that. But if you do that, you can put a cushion, reduce the, yeah, that shouldn't be happening even with the seatbelt on. So you probably need a bit of a look at, just to see if he needs a different type of mounting system that's going to stick a little bit better into the skin, so that if it does get bumped, it's not going to leak. Yeah, probably time for a review. But if he's, the flat products are just, when you look at them on the side, it's completely flat. If he's in that, he probably needs like a softer convex or something that will just fill that in.
Any more questions? A few years ago, Paris was here and I sat to listen to him and I thought I listened pretty well. And although last night I told him I listened a little bit. But really the things I learned by not even concentrating all that much on the things that he said made my life so much better. So the last 3 years, I've managed my stomach so much better, my skin health's been so much better, and my rating's gone from 5 up to 7.5. Paris, thank you. That has been great. And there's so many things that you don't know you've taken away knowledge from this, but it will just help you because he's got covered so well, he's explained it so nicely. And certainly for me, 3 years ago, it helped, and I've even picked up more things today. So, and I thought I knew everything because I've had a stoma for 16 years and I'm a male, and I just thought, gee, I know it all. But, and Jenny will tell you, I used to just pull my bag off like that instead of taking it off gently, and of course that's doing a lot of damage to your skin too. Paris, thank you. Thanks for coming up. Great to see you again.